Hello everyone, welcome to Logic Medico. Today's interesting topic is pectoralis minor. So this pectoralis minor is a muscle present in the pectoral region. It is located deep to the pectoralis major. That is a location. Coming to the origin and insertion, I'll show it diagrammatically. You can present it like this in the exam as well. So let's consider this as the third, fourth, and fifth rib, and this as the coracoid process of scapula. Only what is required we should show in the exam, not everything. This is good enough to show it as a coracoid process of scapula. You have to use a different color, that is brown color, to show the muzzle. So the muzzle takes origin from these three ribs and finally gets inserted to the coracoid process of scapula. So what is the origin of pectoralis minor? It takes origin from third, fourth and fifth rib at the costochondral junction. So what is the insertion? Also from the fascia covering external intercostal muscle. Insertion is upper surface and medial border of coracoid process. So it's upper surface and the medial border of coracoid process. Nerve supply of this is two nerves in pectoral region. One on the medial aspect coming from the medial cord, it's called the medial pectoral nerve. Other one on the lateral aspect. In fact, this lateral pectoral nerve pierces the pectoralis minor. So I'll show you. So this lateral pectoral nerve comes like this and goes and comes out like this. So it will pierce the pectoralis minor and emerges out of the pectoralis minor. Lateral pectoral nerve coming from the lateral cord of brachial plexus. Medial pectoral nerve from the medial cord of brachial plexus. That is the nerve supply. So what does this pectoralis minor do? What is the action of this pectoralis minor? So it pulls the scapula forwards across the thoracic cage along with serratus anterior. This movement is called as protraction, like in pushing the car or pushing the table or a door. So that movement, the pushing movement, is called as protraction. So pectoralis minor helps in pushing. Also, it helps in depression of the shoulder region, and acting from here, it will pull the rib towards the scapula, so thereby helping in forced inspiration. So it is one of the accessory muscle of inspiration along with pectoralis major. The main muscle of respiration or inspiration is diaphragm, which moves down like a piston. Diaphragm, which is there in the junction between thorax and abdomen, will move down like a piston, causing a negative pressure within the thorax. So all these pectoralis major, minor are accessory muscles of inspiration. So to summarize, pectoralis minor location is deep to pectoralis major, that is in the chest region. What is the origin? Third, fourth and fifth rib at the costochondral junction. Insertion, the upper and medial surface of the coracoid process of the scapula is the insertion. The origin. Nerve supply, medial pectoral nerve, lateral pectoral nerve. Action, it pushes the scapula forwards. The pushing movement is called as protraction of the scapula. Also, it can depress the scapula. Acting from the scapular side, it will pull the rib outwards like this, thereby helping in forced inspiration. So it's an accessory muscle of inspiration. Diaphragm is the major muscle of inspiration. Thank you for watching and learning from Logic Medico. And don't forget to press the thumbs up icon so that this video reaches other people. Okay. Share this video with your other friends. like this video, and if you're new to our channel, kindly consider subscribing. Thank you. Good day.